Good morning. Today we talk about the dentin structure. Dentin is a mineralized connective tissue present in the crown. This is the dentin of the crown, and present in the root called radicular dentin. It underlies the enamel and cementum. It's covered by enamel in the crown and by cementum in the root. It forms slightly before the enamel formation. It determines the shape of the crown, including the cusps and ridges, and also number. And dentin is a mineralized hard tissue forming the main bulk of the tooth, covered by the enamel in the crown and cementum in the root, as we said before. There are two major properties distinguish the dentin from the enamel. First, the dentin is sensitive, and second, it's formed throughout the life. Structure of dentin. Dentin is composed of three structures, which is the dentinal tubules and its odontoblastic process, and peritubular dentin and intertubular dentin. The dentinal matrix of collagen fibers are arranged in the network. As dentin calcified, the hydroxyapatite crystals mask the collagen fibers. The chemical composition of the dentin is composed of 70% minerals as hydroxyapatite crystals and 20% organic materials as collagen fibers and glycoprotein and protoglycan, and 10% water. The bodies of odontoblast are arranged in the layer on the pulpal surface of the dentin, and only their cytoplasmic process or Toms fibers are included in the dentinal tubules in the mineralized matrix of the dentin. Each cell gives rise to one process which travels the predentin and calcified dentin within one dentinal tubule and terminates in the branching network to the dentino-enamel junction or cemento-dentinal junction. Dentinal tubules. The course of dentinal tubules is follow the gentle curve in the crown where it resembles an S shape. Start at right angle at the pulpal surface. The first convexity of this doubly curved course is directed toward the apex of the tooth. This is the S shape. This is perpendicular on the pulpal surface, and the first convexity toward the apex of the tooth. And this is the second convexity. Also, this terminates on the perpendicular on the dentino-enamel junction. This tubule and perpendicular to the dentino-enamel junction in the crown, and also on the cemento-dentinal junction. And it is almost straight near the root tip and along the incisal edge and cusp tip, as we said before. Dentin thickness range from 3 to 10 millimeter or more. Ratio between outer and the inner surface of the dentin is about 5 in the outer surface and 1 near the pulp. Number of tubules per square millimeters varies from 15,000 at the dentino-enamel junction to the 65,000 at the pulp density, and diameter increase with the depth. This represents the curvature of the dentinal tubules, as we said, like S shape, perpendicular on the dentino-enamel junction and also perpendicular to the pulp surface. B represents the dentino-enamel junction, and C represents the mantle dentin, and D represents the circumpulpal dentin. Both C and D represent the primary type of dentin. There are more tubules per unit area in the crown than in the root. These dentinal tubules have lateral branch throughout the dentine, which are termed canaliculi or microtubules. This is represent the microtubules or lateral branch of the dentinal tubules, and this is the dentinal tubules and contain the black color is the odontoplasmic process. This is the dentino-enamel junction, and this is the enamel structure. This also the dentinal tubules. Near the dentino-enamel junction, there are the enamel spindle, which represent the end of the odontoplasmic process with pass through the dentino-enamel junction. A few odontoplasmic process extend through the dentino-enamel junction into the enamel several millimeters, and this is called the enamel spindle, which represent the structure inside the enamel. Only the ectomesenchymal structure present inside the enamel, because it comes from the dentinal tubules of the dentine. This is the dentino-enamel junction between the enamel and dentine, which is scallop in shape. The convexity of this scallop toward the dentine. First hard tissue interface to develop scalloped with convexity toward the dentine. Scalloping greatest in the cuspal area, more occlusal stress, because it take more occlusal stress during mastication. A branching of odontoblast process here increase the sensitivity. This is the odontoplasmic process, and this is the enamel spindle. This is also the dentino-enamel junction, which is represented as scallop shape, and this is the dentinal tubules, and inside it the black color is the odontoplasmic process. This is the terminal branch of the dentinal tubules with its process. Near the dentino-enamel junction, there's increased branching of these dentinal tubules, and the D represent the odontoplasmic process, which cross the dentino-enamel junction to appear inside the enamel as enamel spindle. The second structure of the dentine is the peritubular dentine. This is the peritubular dentine. This is the electron microscopical pictures of the dentine structure. Represent this the peritubular dentine. It forms the wall of the dentinal tubules and surround them like a collar. This is like a collar shape. Predominant in the coronal dentine rather in radicular dentine. This is present more in coronal part of the dentine. Thickness varies from 0.75 micron at the dentine surface to about 0.4 micron near the pulp. So this is the peritubular dentine is thicker near the surface, so the dentinal tubules is wider near the pulp than the surface. Not well differentiated in the young dentine. It is about 40% more mineralized than the intertubular dentine. This is the peritubular dentine, which represents the wall of dentinal tubules. Thickness near the surface is about 0.75 micron, while near the pulp is about 0.4. So the dentinal tubules is larger near the pulp. While this area is represent the intertubular dentine, the mineralization of peritubular dentine is more than the mineralization of the intertubular dentine, about 40% more mineralized here. Also, this is the peritubular dentine, and inside it is the odontoplasmic process, and this structure is the intertubular dentine. This is the cross-section of dentine structure. The dentine that immediately surrounded the dentinal tubules is termed peritubular dentine, as we said, highly mineralized, more than the intertubular dentine, about 40%. Thickness, we said, near the outer surface, about 0.75 micron, than the inner dentine, which is about 0.4 micrometer. Calcified tubule wall has an inner organic lining termed the lamina limitans. The inner surface of the peritubular dentine is called lamina limitans, which is high in glucose aminoglycan. The third structure of the dentine is the intertubular dentine, which is the area between the peritubular dentine. This is the peritubular dentine, which represents the wall of dentinal tubules, and this area between two adjacent dentinal tubules is called intertubular dentine, which represents the main body of the dentine, located between dentinal tubules or mostly between zones of peritubular dentine. Its organic matrix is retained after decalcification. After decalcification, the organic material like collagen fibers and protein is retained after decalcification, whereas peritubular dentine is not retained the organic matrix after decalcification. This intertubular dentine is less mineralized than peritubular dentine. Hardness of hydroxyapatite crystals is about 52. The diagram represents the cross-section of the dentine structure. This is the peritubular dentine, and this inside it is the odontoblasmic process, and this is the intertubular dentine. This is electronic microscopical picture, shows this intertubular dentine, which contain more organic material like collagen fibers and protein, and less mineralized than this area, which is represent the peritubular dentine. The odontoblasmic process, which is present inside the dentinal tubules, is also called Tom's fibers, is cytoplasmic extension of odontoblast cell. The odontoblasts reside in the peripheral part of the pulp predentine border, and their processes extend into the dentinal tubules. This is the body of odontoblastic cells, and this is the odontoblasmic process or Tom's fibers, which are present inside the predentine and also in mineralized dentine, which is the circumpulpal and mantle dentine. When it reaches the dentino-enamel junction, it becomes taper. It is wider near the cell body or near the pulp, and it becomes narrower near the dentino-enamel junction, and this represents the microtubules or lateral branch of this dentinal tubules with its process. This is the process, and this is the dentinal tubules, and this is the branches of dentinal tubules. The odontoblast cell body are approximately 7 micron in diameter and 40 micron in length, as we said in a previous lecture. Types of dentine. We have 3 types of dentine: primary dentine, secondary dentine, and tertiary dentine. Primary dentine and secondary dentine represent the physiological type of dentine or normal dentine, while tertiary dentine represent the pathological type of dentine during stimuli due to dental caries or attrition, abrasion, or cavity preparation. Primary dentine, we have 2 types, which is discussed before in the previous lecture, which is the mantle dentine, which is the first mineralized dentine near the dentino-enamel junction in the crown and near the cemento-dentinal junction in the root. And second type of primary dentine is the circumpulpal dentine. The primary dentine is the dentine that is formed prior to the eruption of the tooth. classified as orthodentine. The tubule form the dentine lacking of cells found in teeth of all dentate mammals, secreted at the relatively higher rate than the secondary and tertiary type, constitute major part of the dentine in the tooth. So this is A represent the primary dentine, and B represent the secondary dentine, and C represent the tertiary type of dentine near the pulp. So this is the dentinal tubules and its odontoplasmic process. Mantle dentine is the first formed dentine in the crown underlying the dentino-enamel junction. Regular in the structure, dentinal tubules form S-shape as a result of directional movement of the odontoblast. So we have primary curvature and we have secondary curvature, which is due to the movement of these odontoblast cell body. It is the outer or most peripheral part of the primary dentine. Regarding the mantle dentine, it is the outer or most peripheral part near the dentino-enamel junction in the crown and near the cemento-dentinal junction in the root, and is about 150 micrometer in thickness. While circumpulpal dentine form the remaining primary dentine or the bulk of the tooth, the fibrils are much smaller in the diameter and are more closely packed together, slightly more mineral content than in the mantle dentine. So the difference between the mantle dentine and circumpulpal dentine in location and in thickness and this in the formation of the collagen fibers. The collagen fibers present in the mantle dentine of the crown is von Korff's fibers, type 3 collagen fibers, which is thicker and perpendicular on the dentino-enamel junction, while the fibers present in the circumpulpal dentine is fine fibers with type 1 and is parallel to the tooth surface. Also, the minerals present in the circumpulpal dentine is more minerals than the mantle dentine. As we said, mantle dentine is the first layer of primary to be deposited. All this dentine and produce adjacent to the enamel in the crown can be recognized by the characteristic thick, fan-shaped collagen fibers deposit immediately sub-adjacent to the basal lamina in the histological section, which is called von Korff's fibers. Fibers run roughly perpendicular to the dentino-enamel junction. The thickness of this mantle dentine about 150 micrometer thick, slightly less mineralized than the circumpulpal dentine. This is C, with the pointer represent the mantle dentine. Near this area is the enamel, and B is represent the dentine. This is the dentinal tubules. When viewed under polarized light in this picture, the mantle dentine red band can be differentiated from the circumpulpal dentine, which is purple in here. This is due to the difference in the collagen fibers in the mantle dentine, type von Korff's fiber here. Circumpulpal dentine formed after the layer of mantle dentine has been deposited constitute major part of primary and secondary dentine. Hydroxyapatite crystals are deposited on the surface and within the fibril and continue to grow as mineralization proceeds, resulting in an increased mineral content of dentine. So the circumpulpal dentine mineralization is more than the mantle dentine. Also, circumpulpal dentine is mineralization through calcospherite in the mineralization front between predentine and mineralizing dentine. The type of mineralization in circumpulpal is near linear mineralization, while in the mantle dentin is called globular mineralization. The second type of dentin is the secondary dentin, which is also a physiological type of dentin. This is the secondary dentin, formed after root completion, after eruption. Narrow band of dentin bordering the pulp, contain fewer tubules than primary dentin, less dentinal tubules here. There is usually a band in the tubule where primary and secondary dentin interface. This is the band between communication between primary and secondary dentin. This is also the primary dentin, and this is the secondary dentin near the pulp. Develop after root completion, narrow band bordering the pulp, deposit more slowly, about 1 micro a day, contain fewer dentinal tubules than primary, as we said. Bending of a tubule at the primary and secondary dentin interface formed in a great amount roof of pulp chamber protecting the pulp horn. So it's more present in the pulp horn and near the roof of the pulp chamber. This is also the secondary dentin. Since it is formed after eruption, the odontoblast slightly change direction, which contribute to the bending of the dentinal tubules. There is usually a band in the tubule where primary and secondary dentin interface. Third type of dentin is the tertiary dentin or irregular dentin or pathological type of dentin. By pathological process or operative procedure, the odontoblastic process are exposed or cut. The odontoblast die or survive depending on the extent of injury. So this is tertiary dentin is formed due to the stimuli like dental caries, abrasion, attrition, or trauma to the tooth, or cavity preparation. So it is formed due to stimuli. Maybe the odontoblast maybe die or maybe survive. If they survive, dentin that is produced are called reactionary or regenerative dentin. So the tertiary dentin, which is formed from the survived odontoblast or pre-existing odontoblast, is called reactionary or regenerative dentin. While when the odontoblast is killed, are replaced by the migration of undifferentiated mesenchymal cells arising in the deeper layer of the pulp to the dentin interface. When the odontoblast is died due to stimuli, a new odontoblast will be differentiated from undifferentiated cells present inside the pulp and form the new odontoblast, which form the tertiary dentin. This tertiary dentin is called reparative type of dentin. This newly differentiated odontoblast then begin to deposition of reparative dentin to seal off the zone of the injury as the healing process initiated by the pulp, resulting in the resolution of the inflammatory process and removal of dead cells. This type of dentin produced is called reparative dentin. This reparative dentin has fewer and more twisted tubule than normal dentin, so it's different than secondary and primary dentin. Histological difference between reactionary and reparative dentin is that reactionary dentin is deficient in acid protein, so it doesn't stain. Reactionary dentin doesn't stain because it didn't have acid protein. Reactionary dentin appears as either osteodentin type or orthodentin type. Osteodentin means when the odontoblast form the dentin due to stimuli. Sometimes this odontoblast is become inside the dentin matrix and look like the osteocyte present in the bone. So this type of dentin is called osteodentin. Reparative dentin has structureless mineralization as in bone. Dead tract. This is the dead tract, which is black in color. Dentinal tubules become empty of odontoplasmic process, and due to the generation of odontoplasmic process, so the dentinal tubules is filled with air, and in the ground section it appears as a dead tract. The odontoplasmic process disintegrated, and the empty tubule filled with air appear black in transmitted light and white in reflected light. Degeneration is often observed in area of narrow pulpon because of a crowding of odontoblast. This is usually near the pulpon because the odontoblast is crowding in this area. These degenerated empty area demonstrate decreased sensitivity. Dead tract represent the area of decreased sensitivity inside the dentin, seen to a greater extent in older teeth. It's always seen in older teeth than the younger teeth. Dead tract are probably the initial step in the formation of sclerotic dentin, which is type of tertiary dentin. Sclerotic or transparent dentin. This is the sclerotic or transparent dentin. When caries or attrition, abrasion or erosion or cavity preparation cause collagen fibers and epitatic crystals to begin appearing in the dentinal tubules. This blocking of tubules may be considered as the defensive reaction of dentin. Sclerotic dentin when the dentinal tubules is filled with hydroxyapatite crystals, filled and look like as the enamel structure. This become as brittle and called transparent type of dentin, and this is for protection. These epitatic crystals are initially only sporadic in dentinal tubules, but gradually fill it with a fine meshwork of crystals. This is filling in this dentinal tubules by a mesh of hydroxyapatite crystals, so it looks like the enamel structure become transparent. As this continues, the tubule lumen is obliterated with mineral which appear very much like the peritubular dentin and also enamel. The refractive indices of dentin in such area become transparent in transmitted and dark in reflected light. This area also has decreased permeability, look like the dead tract. We have histological section structure is a hypocalcified structure. First incremental line present inside the dentin. First incremental line is von Ebner, second incremental is counter line of Ewens, and third incremental is a neonatal line. Also we have a hypocalcified structure called interglobular dentin, and also a granular layer of tomes. We talk about incremental line present inside dentin. We have a three incremental line. First of all is called von Ebner line or imbrication line of Ebner's. Appear as fine line or striation in dentin. This is the line of von Ebner. This is perpendicular on the dentinal tubules. Between each line there's about 4 micron thickness. This line represents the periodic formation of the dentin daily by odontoblast. So this line is represent the rhythmic deposition of dentin. This is also the incremental line histological section. This is the line which is perpendicular on the dentinal tubules here. This is the incremental line of von Ebner or imbrication line between two lines about 4 micron in thickness. Second line is the counter line of ions. This is the counter line of ions present in the ground, longitudinal ground section of the dentine. The course of the line indicates the growth pattern of the dentine. Some of these incremental lines are accentuated because of disturbances in the matrix and also remineralization process during dentinogenesis. So this line called line of ions. This line represents the hypocalcified band. This is also the ground section of the tooth. This is the enamel, and this is the dentino-enamel junction, and this is the dentine of the crown, and this is the dentine of the root. This line of ions is present inside the crown and also inside the dentine of the root. The third line present inside the dentine is a neonatal line. In the deciduous teeth and in the first permanent molar, the prenatal and postnatal dentine is separated by accentuated counter line, which is called the neonatal, because the dentine, some of the dentine is formed before birth and the rest of the dentine is formed after birth. So there's a difference in the environment between before and after birth. So there is a neonatal line represent the prenatal dentine than the postnatal dentine. This is the neonatal line present here inside the dentine. Also, we have a neonatal line inside the enamel. This picture represents the hypocalcified area, which is called interglobular dentine. We discussed before in the previous lecture. This is the interglobular dentine, and this is also the lower bar of the interglobular dentine, present in the area near the dentino-enamel junction, present in the crown. In this area, there is hypomineralization occur here because of the dentinal tubules didn't have the secondary mineralization, only a primary mineralization occur, and there is the ununion of the globules fusion, not completely fusion between the globules of mineralization, and this area is occur as interglobular. Another hypocalcified structure present in the dentine is granular layer of tomes. This is the granular layer of tomes, which is represent black granules near the cementum. This is the cementum, and this is also the cementum, and this is the granular layer of tomes. Granular zone under transmitted light inside on present only inside the root, and the dentine of the root close to the cementum, didn't present inside the dentine of the crown. Why this occur? Due to the looping and coalescing of dentinal tubules. It is hypomineralized area, increase in amount from the cemento-enamel junction to the apex, from the cervical region to the apical region. This is in the cross section, also the tomes granular layer. Dentine sensitivity, or theories of dentine sensitivity. We have three theories in describe the dentine sensitivity. One of them is a true theory, which is the hydrodynamic theory. The previous theory is the nerve theory, which will represent there is a nerve inside the dentinal tubules which transmit the sensation to the hypothalamus. And the second theory represents that there is the odontoplasmic process as a receptor which transmits the pain, while the new theory is the hydrodynamic theory, which depends on the fluid present inside the dentinal tubules, which transmit the pressure to the nerve ending near the odontoplasmic process inside the pulp and transmit the pain inside the dentin structure. That's all for this lecture. Thank you.